Treatment options for developing youth presenting symptoms of bipolar disorder has been a topic of controversy in recent years. Is it safe while their brains are still growing? Is the diagnosis accurate that early on? Is the risk worth the reward? This presentation will discuss why brain-altering drugs designed to treat bipolar disorder should not be prescribed in developing youth. Before we delve into things, let us define the two sides of bipolar disorder, mania and depression. As shown here, each of these have symptoms unique to them. There are different kinds of bipolar disorder that lean one way primarily or both ways alternately. The difficulty in diagnosis regarding adolescence is differentiating between symptoms and normal stressors that a developing child encounters. Another difficulty encountered in youth is the presentation of symptoms that lend to multiple diagnoses. There are no definitive tests to diagnose most of these ailments, yet children are often afflicted with both. Waiting to medicate bipolar disorder would allow for the diagnosis, treatment, and medication needed for other disorders that affect a child's development on a physical and mental level, especially regarding education. When it comes to prescribing medications, professionals have determined that there is a gap between pediatric general care and psychiatric care. Psychiatric experts are able to carefully observe the child in a way that allows them to select medication effectively, something that pediatricians don't have the luxury of doing. Most children do not have or cannot afford psychiatric care and therefore are not diagnosed correctly or medicated effectively. Taking a closer look at prescription of medication in general by some sort of medical professional, experts have defined this as a sort of guessing game. With the lack of clinical trial on children and their developing minds, this process is an experiment at best, done to determine what ratio or mixture of medications are effective in each specific case. They have little to no way of knowing which medications will work on this child, who may or may not have the disorder, rather than normal childhood stressors. After the medication is prescribed, a sort of cycle is created. New symptoms are presented, leading to a doctor's visit or to a pediatrician or hopefully a psychiatric professional. An examination of new symptoms is conducted, leading to new medication or an increase of dosage on existing medication. After this new or increased medication has time to take effect, new symptoms eventually arise. Zooming in even further, we can peek at the actual medications that are prescribed as well as their safety. Every medication has side effects, whether good or bad. There is a distinct lack of clinical trials and medications prescribed to children that are tested on actual children. Without these clinical trials on the prescribed audience, there is no way to know how it will affect the developing brains versus the already developed. This leads to an overtrust of a few clinical trials that have been done and an uneducated sway of prescription. Clinical trials in general present a sort of ethical issue, providing reasoning for the lack of them that have been done. The FDA provided an incentive to combat this, a 6-month patent on the drugs that are used in result of this, preventing generic drugs to be created or sold for that 6 months. This leads to a study overlaunch on children and further leading to a black box warning to be put on certain drugs with the potential side effects of suicidal tendencies. These clinical trials resulted in the following. Drugs that have been tested sufficiently and are safe for use consist of lithium, risperidone, olanzapine, and aripiprazole. Just because they're marked as safe doesn't mean that there aren't side effects, just that the rewards potentially outweigh the risk in most children. There are various drugs such as divalproex sodium that are either not safe or have not been studied enough. This does not mean that they are not still prescribed, however. In conclusion, drugs treating bipolar disorder should not be given to developing adolescents. These drugs haven't been studied thoroughly, lead to stunts or issues in development, and aren't prescribed effectively. Until we have a set way to diagnose and treat bipolar disorder at such a young age, we should not be able to take these risks and potentially cause dependency or problems in their life down the line.